Okay, we'll get started with the muscles of the anterior upper arm now. So we did the bones, now we'll do the muscles. And one term I want to go over with everyone before we continue is the term brachial, which we'll use a lot when dealing with the arms, especially the upper arm, which means arm or arm-like process. And that's just important because you're going to see this name in a ton of muscles, and if you can just recognize the word brachial, there's a good chance it'll be in the arm. One other super amazing point to make about the anterior, well, at least the three anterior upper arm muscles we'll be talking about today, is they're all innervated by one nerve, which is just makes me ecstatic, and that is the musculocutaneous nerve. Musculocutaneous nerve. So you don't have to worry about that for the three muscles that we go over next. Musculocutaneous nerve. And this is a branch off the brachial plexus, which we'll go over in a future video. So before we go into the three muscles we're about to talk about, it's also nice to know that the blood supply for all three of these muscles is actually the same, and that is the brachial artery. So it makes it easy on us. The innervation is musculocutaneous, and the blood supply is brachial artery. So let's go ahead now and go into the three muscles. The first muscle of the three that we're going to talk about is called the brachialis muscle. So there's that term again, brachial. So this would be the brachialis muscle. It actually originates from the lower anterior surface of the humerus. So it's about right here, and it goes right here, and this will be the insertion point and origin. So this is the origin right here. This is the insertion point along here. Let me just fill this in here. And the job of this muscle is to flex the forearm. So it'll bend at the elbow joint here and lift the forearm or flex the forearm. And it actually inserts on two specific sites, which I'll write down right now. So this muscle inserts over two specific parts here. So let me go over this. Insertion is going to be the coronoid process of the ulna, and also the ulnar tuberosity. There you go. And it just originates in the lower anterior part of the humerus. Let me write down the name of this muscle as well. It's called the brachialis. Right here. And also don't forget that this is, just a reminder, this is the humerus. So once again, just so I can write it down here, the function of this is to flex the forearm. Which makes sense when you see the location of it from the middle of the humerus to the ulnar here, and it just flexes this elbow joint. Okay, so now let's go into the second muscle we're going to talk about. The next muscle we're going to talk about actually originates right here off the coracoid process of the scapula, and it inserts the medial portion of the humerus bone. So let me fill this in here real quick, but the name of this muscle is going to make sense because it's called the Coracobrachialis, which makes sense because it's the coracoid process and brachialis, just like this one. So it's a coracoid brachialis. Let me write that down here. Of course, it's innervated by the musculocutaneous nerve, and it gets its blood from the brachial artery. So the function of the coracobrachialis muscle is to flex and adduct the arm. And that makes sense of where it's located. It's on the medial side of the humerus, so it's going to pull that arm closer to the body. So that's the adduct portion of it. And it's going to flex at the shoulder joint. So make sure you don't get it confused that this flexes the forearm, flexes the elbow joint. This one will flex the shoulder joint. And that is the function of the coracobrachialis. From the coracoid process, the origin, and inserts on the medial aspect of the humerus. And let's go ahead and go into our third muscle now. Okay, our last muscle is by far the most famous anterior upper arm muscle. It's the one all your friends probably flex to you to show you how buff they are. It's called the Biceps Brachii, and it has two heads. One head comes off the coracoid process right here, and another head comes off the supraglenoid tubercle, which we talked about, which is right here in between this humerus bone and the scapula. And it kind of wraps around the humerus through a space here called the intertubercular sulcus, and then this is where it'll meet up with the other head as well. So it'll kind of look like this. It'll have two parts to it, and it will. So these are the origins: the supraglenoid tubercle and the coracoid process, and it will insert on the radiotuberosity of the radius bone right here. So let me draw the rest of this in here. So it'll look similar, something similar to this. Obviously, this is not the most accurate drawing, but it gets the point across. Now the function of this muscle is to flex the arm at the shoulder. It's also to flex the forearm at the elbow joint, and it also serves to flex or supinate the forearm, so which causes your palm to go anteriorly. So let me just make this a little bit wider, just because the real muscle is actually quite big, and that's why they're always showing it off to you. There you go. Just like that. And then, so the heads have two names too, and they make sense. One of them is called the short head, which is this one, as you could guess, because it's much shorter. And this is the long head that goes all the way around to the supraglenoid tubercle. These are the origins, and the insertion is down here on the radius. So let me write down the names of everything. This is the Biceps Brachii right here. And then let me also write down the function of it is to flex the arm and forearm, and it also supinates the forearm, which makes sense when you see its location. It can kind of turn the palm anteriorly. It has extensions all the way up to the scapula, so it can move this shoulder joint forward and flex it. And it also makes sense right here because it can flex this forearm up as it pulls up here. This forearm will flex up. So that makes sense. Once again, it's innervated by the musculocutaneous nerve, and it gets its blood from the brachial artery. Let me also write down the name of the insertion point right here. It's called the radial tuberosity. There you go. And this is the radius bone, so that makes sense. Okay, so now we can probably move into the next segment, which will probably be the posterior upper arm. All right, see you then.